Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. These are some of the highlights at this hour. Health Minister Dr. Sage Hanire meets with some stakeholders on curbing coronavirus transmission, raises hope of a Nigerian vaccine through collaborative efforts with other countries. Abia Isolation Center in Umuahia now ready for use as Minister of State for Health commissions 50-bed ultra-modern medical center. And the United Kingdom struggles with coronavirus spread with more patients admitted into England hospitals. And it's a protest like no other across the country. It's also a reminder to reinforce the messages on hand and respiratory hygiene and also staying safe. Remember to avoid touching your eyes, your nose and mouth with unwashed hands. Also avoid shaking hands, hugging and any other form of physical contact where possible. We begin in Lagos, where total confirmed COVID-19 cases passed the 20,000 mark last night after the NCDC reported 113 new cases in the state alone. Now, Lagos, the epicenter of the virus since the outbreak began, has also recorded the highest discharges at 15,250. Active cases in the state stands at 4,568. It has lost 204 people to the disease. Well, last night, other states like Kaduna, Osun, Ondo, Oyo, Ogun, Bayelsa, Taraba, Edo, the FCT, Katsina, and Plateau states all recorded more cases, putting the numbers all together in 24 hours at 163. Only 24 recoveries were made in 4 states and the Federal Capital Territory. The African continent continues to see recoveries with more than 1.3 million people who have been discharged, while the death toll stands at over 38,000. Africa has confirmed over 1.5 million cases of COVID-19. In the meantime, over 26 million people have recovered from the virus worldwide, with, however, 37 million people confirmed. Now, as the world continues to battle the COVID-19 spread, the Minister of Health, Dr. Sage Hanire, is optimistic that ongoing collaboration between Nigeria and other countries will soon result in the production of vaccines. The minister was speaking today in his office in Abuja during a meeting with the leadership of the Association of Hospitals and Administrative Pharmacists of Nigeria. He says Nigeria cannot afford to sit on the fence on the issue of coronavirus vaccines.
Our researchers are also doing their own towards learning more about producing vaccines, and Nhrc we also have to get the necessary pre-qualification for us, which they are working on. But we are with the World Health Organization group that is working to secure vaccines for lower and low middle income countries where we are well represented, and also talking to other countries who are working on the same program to see who is successful in developing and can either share the vaccine with us or share the technology with us. We have spoken with various other countries and received options of offers of cooperation, and we are not throwing anything away, any opportunity away. With regard to the testing, the modality is being worked out. We have to select how to go about it, and we are working on that. And immediately the modality is worked out, then the 1-week surge testing will be conducted so that it covers a representative area of the country, and we can have a result that we are happy with and that the international community will also understand and support.
Let's take you to Abia State, where the Minister of State for Health, Dr. Olorunniyi Mamora, commissioned the Abia Care Center at the Federal Medical Center, Umuahia, the state capital. A 50-bed ultra-modern medical center was certified by the NCDC for the management of COVID-19 cases in the state.
It's a celebration of selflessness, it's a celebration of partnership in different forms. Partnership between the private sector and the public sector, partnership between those in diaspora and those back home, partnership between the federal and the state, because it's a federal institution, isn't it? And you know why you decided to decide this in this federal institution? And it doesn't really matter, because at the end of the day, the beneficiaries are the Abians, and primarily those that live here.
We are not out to celebrate yet by any means, because we still have a battle at our hands and we have to keep pushing. But the data doesn't lie. If I ask you how many patients are in your treatment center today versus how many were in April and May, the data speaks for itself. So we must have done something right. We must be proud of it, and we must continue doing the right things whenever we can.
Following the federal government's order on the resumption of unity schools across the country, in Enugu State, the federal government college Enugu resumed school activities today after 6 months of lockdown. Both the principal and students excited to be back said the resumption is apt to enable them make up for the time school were not in session.
We have put in place all COVID-19 guidelines for resumption. Starting from the gates, we have sanitizer, hand washing machine, we have soaps at various spots. When you are coming into the office, you saw one downstairs. We are by the hostels, we are at the entrance to the hall, at the clinic, in front of all classroom blocks. Each student came in with 5 face masks, and since we were moving around, you can see them using it. So no face mask, no entrance. So the school is quite prepared for student resumption.
I was praying to come back, and thank God I'm back. And we are going to keep complying with the rules to keep ourselves safe from the disease.
In Port Harcourt, River State, the federal government college joined the list of other unity schools the first day, recording an impressive turnout of students and teachers, clearly excited to be back to regular academic session. According to the management of FGC Port Harcourt, all necessary measures and facilities are in place to curtail COVID-19.
As a federal school, we are closely monitored and given directives at every point. We were given directives to put things in place, wash hands, positions like this, all over the classroom in dormitory. Then we were to do social distancing. We have an isolation center. Then we have the clinic. Then if any student shows any symptom, we are directed to call the parents immediately.
The 7 months at home has been slightly hectic, if I should say, and coming back to school is good. Get the blood pumping on learning again, and we can focus on our studies better. So being at home, lazing around, doing nothing, it's actually great to get back to school.
I wash my hands a lot. I wash my hands. I observe social distancing anywhere I find myself. Then I always go out with my face mask and hand sanitizers.
The federal government girls' college Ibusa, Delta State, one of the unity schools, also resumed activities today. Even though a boarding school, several buckets, hand-washing buckets, also soaps and water could be seen at various points around the school premises.
Our pre-resumption preparation started with getting the teachers aware. We have had workshop and seminars and training for the training of the teachers on compliance with the COVID-19 protocol. And we had, in addition to that, before the student actually left, we had sessions with them before they closed abruptly. And then while at home, lectures were taken online. And the process of taking the lectures online, we also pass some of this information to them.
shaking hands, hugging. We will not be doing it for now. Yes, but we see each other, we wave at each other, they gist, but it will be social distancing.
Enter the class, we wash our hands. Then as we enter, we sanitize. Then if we go out for break, we also wash our hands before entering again, then sanitize. And also put on face masks and observe social distancing.
The new normal for students. Now let's go over to Abuja, but just before we get our guest on, the National Human Rights Commission alleged that some hospitals have been violating the rights of many asthmatic patients. Some patients are being forced to accept COVID-19 diagnosis by some hospitals, even though it is not true. We have joining us Mr. Harry Obey, is the Director, Women, Children, Vulnerable Groups Department of the Nhrc. Thank you for joining us on the program. Tell us about the report and where it occurred.
Thank you very much. The issue of allegations of patients being forced to take COVID tests or even treated shabbily because they present symptoms that appears to be COVID-like symptoms has been rife since the issue of the pandemic started. You recall that even PTF had cause to flag this issue of many patients dying as a result of neglect by health professionals not attending to them because they were scared of contracting COVID. That was at the initial time. But specifically on this allegation of an asthmatic patient being forced to take COVID tests, it happened in Rivers State, Port Harcourt. Sometimes in April, the Commission's office in Port Harcourt received a complaint from a known asthmatic patient that went to his hospital and he was having difficulty in breathing, and he was allegedly asked to go and take COVID tests before he could be attended to. In fact, the allegation further had it that he went, took the COVID test, and even when he presented the result, he was still shabbily treated. And so that resulted in the complaint that he laid or filed before the Commission's office in Port Harcourt. The case is being investigated. We have made contact with the relevant hospitals, and but we have not concluded, so we will not be able to give you the full details of the allegation now. But yeah, it's happening. And asthmatic patients are a bit vulnerable because, like we know, asthma presents symptoms that looks like COVID symptoms, shortness of breath, difficulty in breathing, and things like that. So
I must quickly ask you,
it actually happened in Port
Mr. Obey, just before we let you go, I know the NHRC sort of has human rights guidelines on the coronavirus. What does it say about a person who refuses to take a COVID-19 test?
Yeah, the guidelines we have basically talks about treating people with dignity and mainstreaming human rights into COVID treatment. And it applies to treatment centers worldwide and other health facilities. Yeah, it prohibits forcing anybody to take a particular test. But you know that there are exceptions under the Health Act, the National Health Act, where it touches on issues of pandemic or epidemic that can endanger lives of the members of the community. There are certain steps that can be taken to ensure that tests are taken. But in whatever circumstance, nobody is allowed to be treated shabbily or forced to take a test in a way that breaches on the person's right to dignity of human person.
So essentially, the exception to every rule. We appreciate your time. Thank you so much, Mr. Harry Obey. He's the Director, Women, Children, Vulnerable Groups Department of the NHRC. Thank you for joining us on the program.
It's a pleasure to be here. Thank you.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. In Lagos, all of the classes in both public and private schools in the state have been asked to resume next week, Monday, 19th of October. This announcement was made by the State Commissioner for Education, Mrs. Folashade Adefisayo. According to her, the physical resumption, which is for 2020-2021 academic session, will now include pupils in pre-primary like daycare, kindergarten and nursery schools. She says the decision was taken after careful deliberations and consultations with relevant stakeholders, including safety professionals and nursery school providers. The Commissioner also says all public and private schools are strongly advised to put safety first by adhering to the COVID-19 safety protocols, and the Office of Education Quality Assurance will continue to monitor and evaluate schools' preparedness. And students of the Federal Science and Technical College, Awka, Anambra State, they've resumed after over 6 months staying at home due to COVID-19 pandemic. At the school, returning students were first checked before entering their classes. Teachers were also on ground to ensure strict compliance with the COVID-19 safety measures, while instruction they're saying entry without face masks not allowed.
I'm very happy that today the students are returning back to school after 6 months or more of staying at home. It has not been easy, both for the parents and for the students.
They were all through in the house, burning data because of online lesson. It wasn't easy.
Well, according to health experts, not only testing, but a combination of the non-pharmaceutical interventions can bring the pandemic to its heel. Yimika Oguns is the coordinator, Pharmaceutical Society of Nigeria, Young Pharmacists Group, Lagos State Chapter. Her interests revolve around policy advocacy with emphasis on health and education policies. Thank you for joining us on the program.
Thank you for having me.
All right. First, tell us about your opinion, young people taking responsibility, especially with non-pharmaceutical protocols. Are they taking responsibility?
I would say they are, because in the first place, the rate of adoption for any new policies has to start with the young people. We have a higher number of young people in Nigeria. So starting with wearing the face mask, the social distancing protocols, and then going on to hand-washing techniques and a whole lot of other things. Young people have really taken up that challenge, and they've made it a point of duty. Additionally, we know that we tend to be on the patent side a lot, being young people, but a whole lot of that has dropped in the past couple of months. So I would say that, yes, young people really, really stood up to the occasion.
So we understand different countries are using different combinations of approaches. For example, Korea, they relied on face masking and testing. We know China, I think there's a whole area that is going to test millions of people in about less than 6 days. We understand as well in New Zealand, border closures, contact tracing were also enforced. Greece relied more on banning gatherings and then school closures. But how do you assess Nigeria's combinations of approaches so far?
Okay, so in the first place, I would say that the projections were a whole lot worse than what we currently have, so that's a plus. Although the experts have some questions about we could have closed our borders earlier. Yes, we could have closed them earlier. We could have put some protocols in place faster. But I would say all things considered, we haven't done badly. Having the PTF being set up in response to the occasion, and then we had state governments rising to the occasion, although we can't exactly give all state governments a pass mark. But so far, so good. I would say that we are not doing badly. We're not doing badly at all.
So data from NCDC is showing Lagos holding the top spot for testing. It has, numerous collection sites. We have several other states as well, like Imo, Sokoto, Plateau State. That's also growing its testing capacity. But we also have other states like Kogi, Kebbi, recording lower numbers, testing a little, just over 200. Are you optimistic about the new policy announced by the Presidential Task Force with regards to the National Testing Week?
Okay, in principle, it's a good policy, because if you don't test, you have no way of knowing the exact situation. However, we still have situations with some states not having, should I say, well-equipped testing centers. It's It's a fact, although we might not talk about them so much. So the question would be the implementation. It's one thing to put out a very good policy, another thing is implementation and adoption by the stakeholders. Are people going to be ready to come out to be tested? What protocols are being put in place? I know I read that, okay, you want to work with religious organizations, you want to work with community leaders, but I feel that, yes, and a whole lot, and hoping that they would be able to talk to people and have them buy into the idea. I think we are leaving out one stakeholder. I'm a pharmacist, so it's imperative I mention the role of pharmacists in this because we are the first port of call for patients anytime. And having established a relationship with patients over the years, I think that pharmacists should be involved in the testing. It would go a long way because in every community, you would definitely see a pharmacy there. So I feel that where we might have a challenge will be the adoption. But by the time we have evangelists who understand what the purpose is and can convince people to show up to get tested would be better off.
I just wanted to quickly bring to core what the health minister also said with regards to vaccine, you know, being very hopeful that Nigeria would indeed come out with something. Is there anything in the works and, you know, what is giving the health minister that backing currently? Okay, so I know that currently there's a research institute that's currently working on vaccines. It's a multi-professional team. And also the Nhrc is also currently working on some solutions. So I'm also hopeful that in the not too distant future, we would have something to work with. All right, well, I'd like to thank you so much. Yemika Oguns, the coordinator of the Pharmaceutical Society of Nigeria, Lagos Chapter, Pharmacist Group. Thank you for joining us on the program. Thank you so much for having me. Now, British Prime Minister Boris Johnson has told the Commons that there will be a new 3-level alert system for England, medium, high and very high. The Prime Minister has said he does not believe another national lockdown would be the right course in combating the pandemic. This is as more people are in hospital with COVID-19 than before the lockdown in March. This is according to the NHS Medical Director, Stephen Powis. Meanwhile, in China, Guangdou's population of about 9 million will be tested for COVID-19 over 5 days after 12 cases were confirmed there.
Prime Minister to make a statement. Prime Minister Johnson.
The UK Prime Minister Boris Johnson, while dismissing a second national lockdown, confirmed that most areas already subject to local restrictions on top of the national rules will automatically move into the high alert category, that is Tier 2. He said the very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. Over in France, the Paris region is a race against time to contain COVID-19 cases, according to the health official responsible for the capital and its suburbs, adding that authorities are preparing for every scenario as the number of cases continue to climb. The number of new coronavirus infections in France was 16,101 in the 24 hours of Sunday evening, down from a record of almost 27,000 the previous day. It took the figures to a cumulative total of 734,974 since the start of the year. In Italy, 4 members of the Vatican Swiss Guards, the elite and colourfully dressed corps that protects the Pope, have tested positive for COVID-19. The results came in over the weekend and added to 3 other residents or citizens of the tiny Vatican city-state who have tested positive.
Remember that wearing a face mask incorrectly is as good as not wearing a face mask at all. Continue to take responsibility. Our website, channelstv.com, has lots of updates on the pandemic, several other stories with news happening in Nigeria, Africa, and across the world. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.